Okay, so my next question what was the hardest thing for you to see out of everything? If you could pick one thing, like would it be me here sick? Would it be like the you having to go and pick me up like out of my out of the ranch where I was living, me losing my independence? What was like the absolute hardest thing?
I think just feeling frustrated that there wasn't anything I can do, that you kept coming up with other things like the AG or GA.
Oh yeah,
You know,
skin
yeah,
disorder,
I
and
mean, there
just
was
all these
just
autoimmune things
all these
piling on
things.
top of each other.
Exactly. I think that was the hardest, is that I'm sitting back and it's out of my control.
Yeah,
I think that's the hardest.
yeah. It would be easier
If there was something that I could do.
yeah, if there was for I feel like there's a lot of support groups for family of cancer patients and stuff like that, but there's not really anything for this disease because people don't know. So it probably would have been helpful if there was some support.
It would have given me knowledge, and knowledge is always good.
Yeah, yeah.
But you were the one educating me.
Yeah.
So
yeah.
that's still good.
And what did so the treatment that's been most effective for me, as you know, was low dose naltrexone. So I was here. I was very sick. You were taking care of me a lot, and then you knew when I was going to take it. You knew that night, and then can you explain to me what it was like following up after that?
Well, you had told me that you were going to take it, and I thought, okay, maybe we'll see a little bit of improvement in a few days or a few weeks. And the next morning, you walked out like a different person, and it was just very.
Is that just like my demeanor, sort of my
you
vibe?
You had some color. You just you looked alive. You looked awake. I mean, it was like night and day.
I remember being awake.
I couldn't believe it was you. I mean, it was just.
What did you do with my sick daughter?
So drastic.
Yeah. So how has it been since that? So that was the day after. How has life for me, as you have seen it, been different after that? Like as far as progression and me.
You've had a few
crashes, setbacks.
I'd say setbacks. And when you do, I get kind of mad.
Stop doing so much.
Can't she avoid that?
If I knew how, I probably would.
Yeah. I don't know. It makes me happy. It makes me tentative. Also, don't do too much at one time. But really happy that you're going back to school, and I'm excited about everything you're doing, and every time you've got a lot of energy and happiness. It just makes me happy.
Oh, duh. So as far as other doctors that I went to, you mentioned the doctor in Santa Barbara that you went to go see, and then you also saw 2 chronic fatigue syndrome specialists after that. How was that for you? Was it?
It was weird because you almost knew more than they did. I mean, not that you did, but your level of expertise was just as high as theirs were. And so it really kind of blew me away.
It seemed like that, I'm sure.
Well,
because I'm sure you've never seen 2 people just banter back and forth about the biological side of chronic fatigue syndrome.
I've had a lot of medical terminology in my years, but the terminology and they know, it's so specialized. And to see you go back and forth with them, I mean, they enjoyed it too. They're like, someone that understands.
Yeah.
It was fun. The first guy out in Riverside was fun because he came in and he was very spiritual, and he said, you have this for a reason, to go out and you're going to help people, and that's your mission in life. And it was really kind of cool for him to say that.
Did it help? I know you said you already believed me at that point, but did that just even give you even more of a relief of this is real?
Yeah,
and
it did. It made me more proud of you. But yes, I mean, at that point, I didn't need any coaxing.
Yeah,
to believe
reassurance.
It. No, but it was, especially the second doctor who took you 8 months to get in to see because he travels all over the world. it was nice to hear him say how he was happy how well you were doing.
Because
stuff like that.
He said that's pretty rare to get better.
Yeah.
Or at least like as fast as I did.
So that was interesting. And both doctors have at the end asked if I had any questions. It's like
after we talked for hours and hours.
Hours and hours. And
that's how the specialists are.
I maybe understood 5% of what you guys two were talking about.
Yeah.
So,
but I think, possibly me, I think that would be really important for parents that possibly maybe do still need some coaxing if they do go to a doctor's appointment, or at least like a specialist, someone that does believe the disease, because at that point you already knew. But like if you didn't know, and if you didn't believe me, and if it took me a shorter amount of time to go in there, I would think you would be like, okay, this is real, after all the understanding all the biological things that are going on.
And I like the way Dr. Chia explained how you get CFS too.
Yeah, going
because
through the whole thing.
Because it, in a way, it was over my head, but then he did break it down to describe how basically you got it, and it made sense. Totally made sense, and
it's kind of a relief.
Nice that I understood what he was saying.
And that's definitely a relief. What advice do you have for parents with a child suffering from the condition? What has helped you cope? And I mean, there's even some parents out there, parents that are 80 years old, that have children that are much older, but it's still their babies.
Well, I think it's hard to give advice because everybody's different. Everybody's disease seems to be different.
Yeah.
Everybody's situation is different.
Yeah.
All I would say is, trust your child, what they're saying to you, and listen to what they're saying. Be compassionate, because I'm not always the most compassionate person. But sometimes I like to kick your butt.
But I think that this, in some weird way, like this disease helped you be more compassionate.
Yeah.
With me, it brought that out of you.
Well, yeah.
So you had to be.
Yeah. And one good thing that has come out of this is I feel like it's another chance to parent you.
Did you get me sick on purpose? Did you poison me?
But I think we've gotten closer, actually.
Yeah.
So that's good. We haven't killed each other yet.
Yeah. Stay tuned. Yeah. So, but I think that's really
extremely
good
proud
advice.
of you.
Thank you so much, and thank you for being so supportive. I'm really, really lucky in that way.
I love you, and I'm very proud.
All right. Well, thank you so much for taking time out of your busy day, Mother.
You're so weird. Chip off the old block.
I know.
I love you, and I'm very proud of you, honey.
I love you. She just bit that dog's ear off. It's not a big deal. Just buy a new ear. They have prosthetics these days. And it would have so many bloopers.
That's disgusting. Can we really get rid of really so different for everybody?
Can I ask the question again?
Yes.
So I can see. Yeah, it's okay. I don't think they can see it. So.
Okay, we'll go in bloopers.
I know, yeah, I probably will. So what do you have? Okay.